Hi, everyone. For those of you who've just joined and are wondering why it's a bit quiet, we are just trying to sort out a technical issue. I know that the People's Vaccine Alliance Kenya, I see our fearless leader for this session. Here we go, Joab.
My big apologies. You're trying to sort out some technical issues, and thanks to Brian, who's managed to do that just now. I could see all of you, but I couldn't speak. So welcome to this roundtable discussion. I hope we will make use of the 2 hours now. About 1 hour and 50 minutes because we've lost 10 minutes already. And just to start us off, I think all of us, maybe other than Nabil, but by the virtue that you're in Africa, today is a celebratory day for the continent. This is when we celebrate Africa's unity and when we celebrate the liberation of the continent. But this discussion will actually tell us whether we are truly liberated or we're just celebrating the day to remind ourselves that one day we will be truly liberated. So to start us off this discussion, I think we have great panelists, and I'll just give each one of them 40 seconds to introduce themselves. I'll start with Maza. I know you had her before, but Maza.
Thank you. And I am a last minute addition to this. If you all are expecting Tian Johnson, I apologize, but Tian is not feeling well today. So I will do my best. Those are big shoes to fill, Joab. But my name is Maaza Siyum. I am a proud Ethiopian, Ethiopia being the host to the African Union. So I hold my Ethiopian passport aloft with pride today. And I work at the African Alliance, which is a South African-based civil society organization, and on the steering committee of the People's Vaccine, the Global People's Vaccine Alliance.
Thanks, Maza. I struggle to tell whether you're Ethiopian or not because of the so many languages that you speak. Thank you. I'll move on to Nabil.
Hi everyone, greetings. My name is Nabil. It's a pleasure to be here. Thank you, Joab. I'm at Oxfam International. I'm based here in Nairobi, seeking to join you on this Africa Day. I'm also part of the People's Vaccine Alliance, and Oxfam is a part of that, with organisations, from Amnesty International to the Africa Alliance, to various others from around the world, and joining others as part of the People's Vaccine Alliance to really think through how we can influence the key targets that are out there from the governments, but also, in terms of thinking through the influential figures who are part of this campaign too. So pleasure to be here. Thank you.
Thanks, Nabil. I'll move to Alan.
Thanks for having me here. I'm Alan Maleche. I'm based in Nairobi. I work for a non-governmental organization called KELIN. KELIN in full stands for the Kenya Legal and Ethical Issues Network on HIV and AIDS. We have been closely collaborating with the People Vaccines movement in Kenya in terms of pushing for transparency on documents, information, indemnity agreements, and happy to be part of the conversation today to see whether African solidarity can actually realize vaccinations happening across the continent. Over.
Thank you, Alan. Thank you so much. I think you bring a lot of experience from the HIV and AIDS movement, and there's a lot to learn from that. Violet?
Hello, everyone. My name is Violet Asiko, based in Nairobi, Kenya. I work for the Kenya KMPDU. This is the Kenya Medical Practitioners and Dentists Union. And it's a trade union that represents all medical doctors in Kenya with an aim of improving doctors' welfare. But at the same time, the union is also very active in health advocacy with an objective on ensuring Kenyans have access to high quality health and with an emphasis to public health. So the reason I'm here today is we have a project under KMPDU on people's vaccine. And the project is basically aims to mobilize a coalition so as to add to the voice of an equitable and fair access to the COVID-19 diagnostics, vaccines, and the PPEs. Thank you.
Thank you so much, Violet, and thank you for the great work that you've been doing actually to protect Kenyan nurses and all the medical fraternity in Kenya. Just to start us off, I'll start with Nabil, maybe since you've been doing a lot of work with the Global People's Vaccine Alliance. Could you just speak to us of the state of play of things when it comes to COVID-19 vaccines?
Yeah, sure, Job. Hi, everyone. So I'll provide kind of a quick snapshot of where we are and some of the key developments that we're seeing in the fight for a people's vaccine. And by people's vaccine, we mean, you know, a patent-free, intellectual property-free COVID-19 vaccine, safe and effective, that's available to everyone, everywhere, free at the point of use. And that's a campaign that many of us here have been part of, pushing for, and it really is the issue of our time, because we know the way to end this pandemic is a vaccine, but we're also seeing these stunning contrasts around the world. And let me begin there with the snapshot. So current state of play, 0.3%, that's 0.3% of the world's vaccines have gone to low-income countries. The situation for 2021 alone looks like 9 in 10 people in poor countries would go without a vaccine. Those countries look like to be waiting until 2024 to have their populations immunized. But for some, it could be at least 2024, and for some, it could be never. And there is an array of data to be shared, but obviously the contrast of this is seeing folks in rich countries, in the UK, where my family is, for example, or colleagues across the USA and in Europe get the vaccine. And obviously we're very happy to see that. But these contrasts, they do exist, and this vaccine apartheid that we're witnessing is growing. A year ago, the key barrier to defeating this pandemic, it was science. You know, can we develop a vaccine? Today, the key barrier that exists is inequality. And I want to dive into that just for a moment, and to kind of give you one example that really kind of demonstrates where we are, is that the majority of the world's poor countries are relying on the COVAX mechanism of the United Nations, which essentially is a charitable mechanism that's been put in place where rich countries can purchase vaccines from the big pharmaceutical corporations, and there is a charitable allocation. So the main supplier of COVAX, for example, just to share with you, days ago, which is based in India, which produces the AstraZeneca vaccine, for various reasons, and we can go into that in some detail perhaps later, would not be able to supply more of the AstraZeneca vaccine to COVAX. It says it hopes to by the end of 2021. And you realize the number of countries that are reliant on that. So it is quite a stark situation that we're facing. And as I said, this vaccine apartheid is growing. The key asks, the key push of this People's Vaccine campaign that has really grown from an initiative over a year ago into a global movement of various actors across various countries around the world, united by a common cause to get this vaccine. You know, there have been three kind of key asks that underpin this movement. The first has been this idea of a suspension of intellectual property rules at the World Trade Organization. That was proposed by South Africa, by India, and it's been backed by over 100 developing countries. And that essentially would suspend the legal barriers in place to enable other countries to be able to produce a vaccine. That's one. Second, is the need for what's called technology transfer. So the World Health Organization has a mechanism to enable that technology transfer called the COVID-19 Technology Access Pool. So we want to see, Pfizer, Johnson & Johnson, AstraZeneca, all these companies part of that, so that if you're a producer in Bangladesh or in Indonesia, in South Africa, in Vietnam, in all these countries, that you would be able to have the technology transferred to you to be able to produce those vaccines. And the third key ask is investment. Investment to upscale the capacity that we need to be able to produce those vaccines. So a waiver, technology transfer, and investment. There is some way to go. Not one major pharmaceutical corporation is part of the COVID technology access pool. And I mentioned that we had 100+ developing countries pushing for the waiver. Things are changing, and Joab asked me just to touch on this, is that we saw a major moment just a few weeks ago, a really unprecedented decision by the Biden administration to actually support that call for a waiver of intellectual property rules at the World Trade Organization. And that's quite a stunning decision, especially if you look back at the US's relationship with the big pharma corporations. To actually take a stand against them is something that we haven't seen really ever. So that's given renewed energy to this campaign, but we're also seeing that there is great pushback, and not just a re-energized pushback from the big pharmaceutical corporations, but also, we've seen Europe not yet follow President Biden in that decision and follow the developing countries. And all of this is still happening, folks, at a time in which, we've seen what's happened across Latin America with the spread of the disease, and also in India, which is very, very painful to see. And the real question is, how long can we wait? How many more deadly waves of COVID do we want to see until the international community, does what is necessary to end the pandemic? And the fear is that the worst of this pandemic could yet be ahead of us, not behind us. We've even already seen how The Economist the other day actually estimated that the COVID-19 deaths that we've seen so far are in actuality something close to 10 million. And it's frightening with so much of the world going without a vaccine, what could be ahead of us. Now, I'll just wrap up in a sec, but it's absolutely vital for every country on the planet to be pushing for those asks that I mentioned. But the real impetus lies here with the rich countries, especially those rich countries where the big pharmaceutical corporations are, of course, based. The People's Vaccine Movement, it's hard to summarize in a second, because so many people have been doing so many different things, and so many organizations have been pushing on so many different fronts. But we've seen how activism is working. The Biden administration, of course, received significant pressure. Millions signed petitions. 175, former world leaders and Nobel laureates lobbied President Biden to back the waiver. We've seen action at the shareholder meetings of the big pharmaceutical corporations. We've seen people out on the streets in different countries. So there's a lot of energy behind the campaign, and I think this has to continue. It has to grow. And I'll finish with just this one point. Is that in this situation where we are seeing the rich world get vaccinated, there is a real risk of this dropping off the global agenda. You know how it works. There is a real risk of this becoming a developing country disease. There is a real risk of these big pharma corporations leaders. By the way, we have 9 new pharmaceutical vaccine billionaires. If you want to get a sense, we can make 9 new vaccine billionaires, but we can't vaccinate billions of people. We're seeing all of this happen. And there's a real risk of this falling off the global agenda. So I think keeping the pressure is vital, raising the pressure is vital. There are particular targets, of course, Germany, the European Union, who we expect so much better of. So that energy must continue. And I think, you know, making the pie bigger is the utmost priority here. We have to talk about the allocation, but 0.3% is a scandal. That 0.3% of the vaccines in the world have gone to low-income countries is a scandal. And we need to do all we can, I think, in the next coming weeks and months to be able to make that pie bigger. This isn't about taking vaccines from the rich world to give to the poor world. This is about actually saying that everyone has the right to health, everyone has the right to a vaccine, and that's how we're going to end this pandemic. Thank you.
Thanks, Nabil. Thanks, Nabil. It's very true that we have to make the pie bigger for everyone to be safe everywhere. And I think you've been doing great work as the People's Vaccine Alliance, and the push or the decision by President Biden's administration to actually support a TRIPS waiver could not have come without people's pressure, people demanding that Biden's administration actually supports a people's vaccine. And we're seeing that, unfortunately, that some countries are still not supporting a TRIPS waiver. They're still supporting, they want to make more vaccine billionaires. And talking about 9 new vaccine billionaires, we've seen that even in Kenya, we now have COVID-19 billionaires, right? Yeah, not from the big farmers, but from the tenderpreneurs. And now this comes to you, Violet. And my question is, you've been working with this, you've been advocating for protection of health workers' rights, access to PPEs. How do you feel when you see young people in developed countries actually being vaccinated, and the nurses and healthcare workers in Kenya have no access to the COVID-19 vaccine?
Okay, Job. Okay, the question is a bit subjective. How do I feel? Yeah. I feel terrible. I mean, I feel terrible. It's really unfortunate. Just today, I was going through the Ministry of Health website and just looking at the data that shows how many have been vaccinated to date. And I was seeing that the cumulative persons is about 876,708. And out of those, even the most vulnerable still, when they did the percentages of the priority group, still we are doing very, very badly. Because the health workers, we've only managed to do 18%, above 58 years old, we've only managed to do 31%. The teachers, who are also among the people and the security officers to be vaccinated, we are doing 8% for security officers, we are again doing 16% for teachers. It's what I found interesting is that there's a group called Others, who it's 27%. And of course, it makes me wonder, which is this category we are calling others? Are there people that are not eligible for the vaccine, but they're getting the vaccine? And of course, now the question becomes, if the government had a clear plan on who to vaccinate, why are we then opening it to others, yet above 58 years old, for example, are not able to be vaccinated as much as they would want to? Again, we saw the issue of vaccine shortages in some of the counties, where the vulnerable, again, were not able to be vaccinated. And then, of course, the question again to government is, what is happening in those counties? In other counties, there are cases of vaccine, like they have more vaccines. So where else the government has a task force in place that is coordinating all these efforts, the question becomes, where is the loophole? Why is the plan not working as intended to? Yeah. So yes, my feelings are really, like, I feel like there's a lot of uncoordination with the government with regards to this vaccine. I feel like the information that is out here is also not as accurate as it's supposed to be. And so as I came to this meeting today, my question to all of us was, how can we support government to make these exercise more coordinated, even as we get more vaccines, because we will end up with a situation where we are still not vaccinating the vulnerable groups. And in this case, I'm even talking about the above 58 years old who are more are prone to dying if they get this disease.
No, thank you so much, Violet. I think you pose a very valid question in terms of transparency on who is being vaccinated and how accountable is our government, for example, in terms of following through the plans that it puts in place, before governments get the COVID deliveries, the COVAX deliveries, sorry, they submit a plan. Are they sticking to that plan? And it's a question that we need to ask ourselves. Who should hold our governments accountable to the plans that they do submit to COVAX? I was watching the Kenyan government, the executive arm of government, actually lining up to be vaccinated, and saying that's all in the name of building public confidence. But are we denying the most vulnerable the doses that they require? So I think it's a question that all of us need to think about and see, how do we work together to ensure that the most vulnerable get to be given priority? Maza, Nabil spoke about what's happening at the global level, and you've been convening African folks. You've been leading that conversation on the continent as People's Vaccine Alliance Africa, and I know that African Alliance also sits on the Africa Vaccine Delivery Group. Can you talk to us about what's happening on the continent? How are citizens mobilizing for a people's vaccine?
Mm-hmm. Thank you, Joab. So first of all, I'd like to thank you for having us here, and thank you, Nabil, for giving such a good overview of the work of the People's Vaccine Alliance and the importance of a people's vaccine. I just would like to commend the organizations that lead the People's Vaccine Alliance, because they have made such an effort to include voices from the Global South. So not just our voices as Africans and African civil society organizations, but also voices in Asia and in Latin America and the Caribbean, noting, of course, that, as we move into this next stage of the pandemic, our countries are the ones that will be most affected. And as Nabil regularly reminds us, once all the North Americans and the EU citizens are vaccinated, chances are they will forget about the rest of the world. So our task now is really to coordinate and make the voices from the Global South louder in this, to add that pressure to the pharmaceutical companies and to the leaders of the countries in the Global North, who sort of are holding those doors shut to a certain extent. Nabil talks about the need, and you, Joab, had also mentioned the need for making that pie bigger. And the thing that we know now is that the pie can be made bigger. Manufacturing can be ramped up, and we keep being told that. And there was that quite surprising and disturbing interview that Bill Gates gave a few weeks ago. I know Bill Gates is now busy with other matters, so I have not seen him in the news recently, but there was that interview he gave on Sky News, where when asked, should the IP rights be waived, his immediate answer, without even a pause of reflection, was no. And then he went on to say that, almost implying, he said clearly that, I don't think people understand that manufacturing vaccines is actually a complicated affair, and a lot of the manufacturing entities in the Global South would not be able to do it. And what we've learned is that that is not true, that is possible, with the technology transfer and know-how. So, as I said earlier, unfortunately, Tian Johnson, who leads the African Alliance and sits on the African Vaccine Delivery Alliance as co-chair of the community arm of the vaccine, the AVDA, African Vaccine Delivery Alliance, was not able to join today. And I think Tian would be much better placed to speak about the leadership of the African Union and the African CDC in this work. What I would just like to say is that the African Union and the African CDC have made it clear that their intention is to lead this work for Africa. They do not want it to be led from Geneva or elsewhere, but they are looking for solidarity from countries in the global north. My understanding is that there is a plan, one, to help governments as they do, what Violet has just noted and you have noted, Joab, this work of kind of prioritizing, thinking about access. There is a solidarity package that the African Vaccine Delivery Alliance is working on that will be on a country by country basis. So countries will be able to ask for the solidarity, this package to help with access, tracking, and also community engagement work and vaccine confidence work. And that's something that, comes up over and over, this idea of making sure that as the messaging becomes a little bit more vague now as we go forward, that people don't lose confidence in these vaccines. Nabil, and we've talked about the fact that I actually, feel very strongly that this talk of vaccine hesitancy is exaggerated. People are ready and waiting for vaccines, and that has been noted. I think there is this narrative that there is a huge amount of vaccine hesitancy, but data shows that people are ready and waiting for the vaccine. So I would say keep your eyes peeled, and we will continue to update the African civil society organizations on the work of AVDA. There is a manufacturing arm and there is a community engagement arm of the work that AVDA does, as well as a logistics arm. And they are determined that with those three areas of work and working with governments and civil society organizations, both international and African, that they will be able to help lead that response. In terms of the African Alliance, as you note, Joab, we have been tasked with helping to coordinate the work of the People's Vaccine Alliance in Africa. We have started holding monthly meetings, so I would just invite everyone who is here at this meeting to please join us. We gather on the last Thursday of every month, so we will be meeting this Thursday. I know people are probably very tired of Zoom, but that's going to be Thursday afternoon at 3:30 Nairobi time. And there we try and do several things. One is to brief the African civil society organizations on the work of the People's Vaccine Alliance. Nabil and all of his colleagues have been really good at kind of finding advocacy opportunities in the next month, because things shift so quickly. It's important to keep track of the meetings that are going on at international level, shifts that are happening in the global dialogue about this. Just yesterday, Nabil was telling us of the need now to kind of pressure the Germans, and, the US has agreed to the TRIPS waiver. Germany is holding out as the other European Union countries are sort of wavering. And so we've been kind of brainstorming on how, from our end as African civil society organizations, we can also put that pressure. And, what does that mean? That's what we brainstorm about at these meetings. Are we talking about drafting a joint letter? Are we talking about protesting at embassies? Are we talking about writing op-eds? Should those op-eds be placed from African civil society leaders in US newspapers or European newspapers, or should they be, placed in African newspapers to also pressure our own governments to kind of lean a little bit harder on these issues that we think are important? So that's what we try and do at those meetings, kind of let people know what the upcoming advocacy opportunities are, brainstorm on what we can do together, and also learn from the groups on the ground. There's so much work happening. Obviously, People's Vaccine Kenya, thank you for inviting us today. I know that you all have been very active in Kenya and in the East African region. There are other groups in West Africa, in North Africa, all over Southern Africa that are also doing really good work on these issues. So to give them an opportunity to share, to invite them to join the People's Vaccine Alliance, either officially or unofficially, and really to take those voices from Africa to Nabil and the rest of the leadership to make sure that as they update and refresh the strategies, or I should say we, because we've been fortunate to be invited to sit in the steering committee of the People's Vaccine Alliance. So again, just commending Nabil and your team for trying to keep Southern voices at the table. So I would, I'll put my email in the chat. Please reach out to me if you would like to join those Thursday meetings. We do have a link on our website as well to join those meetings. There is an AVDA page at the African Alliance website that will be updated regularly. So please go to that as well. Joab, I hope that's helpful, and I can take any questions from the group as we go on.
Thank you, Maza. And just to say, we'll have an opportunity for people in this discussion to also contribute to the discussion and ask questions. But if you have very pressing questions, feel free to also type them in the chat. Thank you, Maza, and thank you. And I'll encourage all of us to join the People's Vaccine Alliance Africa calls. They're very interesting calls. We get to share experiences from countries on what's happening and just learn from each other. It's also a space where you can use to vent against those who are hoarding vaccines. Yeah, thanks. Now, coming to you, Alan, Nabil spoke to this about the TRIPS waiver. I mean, the big step that the US government has taken actually to support a people's vaccine. As a person who's been following the TRIPS waiver conversation, you've been engaged in the HIV access to drugs advocacy. You know, you've been involved in litigation. We're witnessing actually what my colleague Nabil actually. I listened to one of the podcasts called Equals, and they were talking about scientific racism, where it's believed now that it's only rich white men who can produce vaccines. So African countries or African people cannot produce vaccines. Can you just speak to us as someone who's been following the TRIPS waiver conversation? If we manage to get the support for a TRIPS waiver from all the WTO countries, all the blockers now, do you think Africa will be able to manufacture the vaccines and everyone will have access to them?
Thank you, Job, once again for having me here, and I will try to put it into context so that our colleagues who are listening in can be able to appreciate why a TRIPS waiver is absolutely important. I think we are 18 or 19 months into the pandemic, and from the WHO details, we see that about 1.5 billion vaccine doses have already been issued or inoculated to people across the globe. And 75% of that supply has only gone to 10 countries. And in the context of Africa that we're speaking about, only 25 million vaccines have been administered, and we all know what the population of Africa is. I think this inequality is what is existing at the moment and is quite disadvantageous to all of us. Now, we all know, and learning from Ebola or learning from other epidemics, what is important, including HIV in the case of ARVs, what is important with viral pandemics is the ability to be able to vaccinate as many people as quickly as possible. And for you to be able to do that, then you have to increase local production of vaccines. Now, the difficulty we've had is that because of the existence of the TRIPS agreement, many of the pharmaceutical companies have chosen to want to shield it and say, we have this agreement that protects us, so we are not going to transfer technology, we're not going to transfer know-how, we're not going to lift intellectual property rights because we are likely to be affected. Now, what that has done is that it has made it difficult for any African country, any country elsewhere that has the ability to produce vaccines locally to be able to do so, get into our negotiation in terms of moving forward. Now, what has become even more difficult, and someone alluded to it earlier, this has forced countries to have individual negotiations with pharmaceutical companies. And as we have seen from documents by Transparency International, different countries have been given different prices and different negotiations. And to no surprise, the countries in the global south are actually paying more than the countries in the global north. And even when you talk about the COVAX facility, the same people who are part of the COVAX facility have played a leading role in hoarding vaccines. So they first bought vaccines and made orders for their people in more quantities than what was needed. And then now COVAX had to go back on the same playing field to deal with a situation where the major players have already ordered for vaccines, and COVAX is also lining up there hoping to get doses. And this is why some countries have not even seen their first COVAX vaccine landing in it. So this inequity is why we are pushing and saying it's important to have a TRIPS waiver, one that would allow intellectual property rights from being lifted, one that would allow the transfer of technology, one that would allow for knowledge and know-how being shared. And this is actually something that the TRIPS agreement envisions and says that TRIPS should not be standing in the way of public health and public health emergencies. And COVID is a perfect example of a public health emergency. So unless we then allow for that to happen so that we can see more local production, which will mean probably lesser prices of the vaccines, and maybe even people can produce for the regions as the AU and the African CDC have been negotiating, then hopefully we can get more people vaccinated. But if we can't do that, we'll then be dealing with the challenge of variants. We'll then be dealing with the challenge of not being able to ensure everyone is protected. And then this also comes with the inequality people are talking about. We'll then see that when those in the global north have fully vaccinated their people and their children, we'll then see a situation where they start putting barriers. They'll say, you can't travel in here if you don't have a vaccine passport. You can't travel here if you can't prove X, Y, and Z. And I think it is important for us to try and keep clarion call and say, whether it's the Russian vaccine, whether it's a Chinese vaccine, whether it's Pfizer, whether it's AstraZeneca, can we have all this be off patent, and can we get the technology transfer to be able to allow people to have this happen? This is almost a replica of what happened with ARVs and HIV, where it took brave scientists in India to be able to demonstrate that you could actually put forth cheaper drugs that would get to the public. And this also required solidarity from other people across the world. So I think African solidarity is extremely important, not only among civil society, but this is a time for African leaders to step up. And if they told us Africa is one, today is the day they need to step up in solidarity and negotiate as a bloc to say, we want this to happen, and this is our position as Africa, because that's the only way out of this pandemic. Otherwise, it will remain an Africa problem or a global South problem when people get vaccinated. So a TRIPS waiver is not a luxury. It's something that we urgently need if we are to win this war against COVID. And as Tedros, or Dr. Tedros has continually said, no one is safe until everyone is safe. And by that we mean everyone has to be vaccinated for us to be able to get. You can't live in your own bubble in the north and expect not to travel this side. So I'll leave it at that, but a TRIPS waiver is extremely important, and transparency is extremely key from all the players, governments, pharmaceutical companies, because the absence of that transparency makes it difficult for us to know exactly what have you negotiated, what have you provided indemnity for. We have seen situations where people say Pfizer is asking for national assets as part of the indemnity to be given in case there are any adverse effects. Can we have more transparency as people engage in some of these conversations? Over to you, John.
Thank you so much, Alan. Thank you. I think you really broadened the conversation around COVID-19 vaccines and the state of play of things being a real scandal when you just spoke about the COVAX facility. And I think the issue of transparency in terms of the contracts that our governments are entering into, the vaccines that we are acquiring, how are they being financed? I think that's really critical. If it's true actually that COVAX, Pfizer is asking for national assets, is it actually following the Chinese model of financing as it has been claimed before? Are our governments actually borrowing to acquire vaccines at very high prices? And it's criminal for me that countries such as Uganda actually pay 3 or 7 times more than countries in Europe, for the same vaccine. And so at this particular time, I want to open up the discussion. If anyone has a question or a contribution to make, or a clarification that he or she wants to make, please feel free to come in. And I hope that Brian, if you are here, you can unmute anyone who wants to speak now.
And Joab, if I may say something just while people are unmuting themselves and getting ready to ask questions, just to second, Alan's really important comments there, from the epidemiological point of view. And I think for people who follow the People's Vaccine Alliance Twitter feed, you will have seen this a few months ago, but even epidemiologists have stated very clearly from all over the world that this has scientifically foolish. You know, there's no way that you can think that you can vaccinate some people in the global north and be safe because of the evolution of the virus. It is just a foolish notion if you think that that will work. So, and it's not just, you know, scientists in South Africa or in, you know, Rwanda that have said this. It's that scientists from all over the world have echoed this. And Nabil, just to say, you know, your important comments from the beginning that, you know, for somebody like myself who has worked on HIV vaccine research and seen how long it has taken us to look for an HIV vaccine and still not found one, it was so heartening and amazing to see all the scientists come together. I mean, part of the reason that a COVID-19 vaccines were discovered so quickly is because there was so much money poured in. Number one, you know, scientists did not have to, you know, stab each other in the back to get funding for research. You know, there was a lot of government money coming in. People were working together. And, you know, as Nabil said, the first hurdle was, can we find a vaccine? And that happened very quickly. And now we will squander all of that success because the vaccines, you know, will need to be retooled, or new vaccines will need to be developed if the variants really continue to evolve in the way that some scientists fear. So that's just something that I wanted to kind of follow up on from what Alan and Nabil had very eloquently said. Thank you.
Thank you so much, Maza. It seems you read my mind, because I just wanted to ask Violet to speak to the issue that Africa has not been hit hardest like other continents, and what's likely to happen when you don't have access to vaccine.
Joab, so about your question, come again. I don't think I really got your question.
I mean, people have been saying across the world that Africa has not been hit like other continents, and therefore, you know, the slow rollout of vaccine, the slow access to vaccines that the continent is experiencing. What's that likely to lead into?
Oh, okay. So how I'd look at it is, first of all, when you come up with such kind of messaging of us, certain continents have not been hit hardest by the virus, that of course just opens room for the inequality that we are really trying to fight against, because it then means countries, governments won't prioritize Africa as a continent that should receive the vaccine. But secondly, how I'd look at it is, when you talk of COVID-19 and the effects it has had on people and countries, it's not only from the point of disease, it's also from the point of economic effects, yeah. And when we look at Africa, I mean, most of the population in Africa relies on informal economy. So when you come up with statistics of it has not been hit hardest, what exactly are you measuring? Are you measuring disease? Are you measuring the economic bit of it? And so, I mean, such kind of messaging is just misleading, first of all, because I do not think at this point in time, we should be, you know, responding based on data that is not really there, and also that is not very objective, because we are talking about health. Yeah, that's my take on that.
Thank you, Violet. Yeah, it's not just a health crisis. It is a social, it's an economic crisis. We've seen how countries that have gone into elections during the COVID time, how elections have turned out to, I think also Alan spoke to the issue of vaccine passports, and that's just likely to shrink further, you know, the space for people to travel and to associate with each other. Thank you so much. I have some hands raised up. I'll start with Ruth and then Catherine. Ruth, you're welcome. You're on mute, Ruth.
Okay, thank you so much, Joab, for this amazing discussion. I'm really happy to listen to the different views from the speakers. Well, first of all, what may be affecting also vaccine rollout in Africa? It's from my own point of view, from the reports I've read in the media and what I've heard people, friends talk about it, it's that One is that the type of vaccine that also Africans that are coming over to the African continent, there's been a lot of complaint, especially among the young people, those who've taken the vaccine, that many of them seem to suffer from blood clots. So this might be one of the issues that might be driving also vaccine hesitancy in Africa. Also the issue that some countries, some African countries like South Africa have already put a stop to the rollout of the Johnson & Johnson vaccine because of its efficacy or something to do like that. And also, I was also reading a report about Chinese vaccines in Zimbabwe. So what does this mean? And people are complaining that these are cheap vaccines which do not give full protection to the African people. So when we are talking about vaccine equity and access, what are we talking? What is our take as Africans about the type of vaccines that our populations are receiving? I think that's my point for now.
Thank you so much, Ruth. Maybe if you could just take 2 seconds to tell us who you are.
Okay, my name is Ruth Mokami and I'm a journalist working in Kenya.
Thank you so much, Ruth. I think it's a question that has been raised, and I know Maza, at some point there was a whole discussion around Johnson & Johnson in South Africa. So maybe if you could just briefly respond to Ruth's concerns around the kind of vaccines that the continent is getting.
Mm-hmm. Thanks, Joab. And Ruth, thank you for the question. I know that there's so much information going around about these different vaccines. I just want to clarify about Johnson & Johnson that was very briefly halted in South Africa when the FDA in the United States, the Food and Drug Administration, had halted when there were a very small number of serious blood clots. I think there were about 6 or 8 serious blood clots, and the Food and Drug Administration in the US halted the rollout of J&J in the United States, and South Africa decided to follow lead. At that point, South Africa was in its final phase of research. So, what they call a phase 3 trial, when it's very large and you're looking for efficacy to see, you always look to see if a vaccine is safe, but in the phase 3, you also look with large numbers at how effective it is in preventing COVID-19 infection and also serious illness and death. So that phase 3 was over. There was 100% avoidance of serious illness and death in South Africa from COVID-19 during that phase 3. And then they went to what they call a phase 4, which is kind of implementation research. So giving an opportunity for health workers to have access to the J&J vaccine. And during that process did not see even one blood clot. So they were in that process when the Food and Drug Administration halted the rollout, and South Africa also halted and then went back to it. So they did go back to it and finish that phase 4 trial with no serious blood clots during that period. And now, from what I understand, are waiting for the shipment to come in to begin proper rollout. Pfizer has started rollout in South Africa in very, very small numbers. So the official start of vaccine rollout in South Africa was 2 weeks ago. But the J&J vaccine will be rolled out, Ruth, once supply is made available. And I'm happy to send you, Ruth, if it is helpful. African Alliance has worked with the South African Medical Research Council to develop some very simple sort of education materials around these blood clots and what they mean and what the data shows. But I know that it is definitely very scary to hear those stories. I just want to add one thing about the Chinese vaccine, and I wonder if the doctors in the group, or maybe even Nabil with your global view, would have something to say. There have been, I think there is a perception that the Chinese vaccine or the Russian vaccine is not as effective, and maybe it's the cynic in me. I do wonder, especially as new white male billionaires are being minted all over the world, if it's in their interest, as AstraZeneca or as Pfizer or as Moderna CEOs, to make sure that that message, is passed. And also, are they, or are the governments governments in these countries, where Pfizer, BioNTech, and Moderna and AstraZeneca are housed, are those governments also pressuring the WHO or others maybe to not approve use of the Chinese and the Russian? Hopefully soon even a Cuban vaccine will come out. So I just I don't want to be too much of a cynic, Nabil, and I know that you're an optimist by nature, so maybe you'll talk me down off my cynical ledge. But sometimes I do wonder, is it in their interest to kind of badmouth the Chinese and the other vaccines? We have heard there was a story that was Seychelles, which is often overlooked as an African country, but last I checked, they are, they've done very well in terms of their vaccine rollout, and they have been using the Chinese vaccine. And there were some stories going around about a wave of infections in the Seychelles following vaccination. But what I've heard is that it matched what we have been told from the research, that the vaccine is not 100% protective against infection, but as I said, in the J&J trial in South Africa, it was 100% protective against serious illness and disease. So I think we have to, serious illness and death. So I think we have to be careful about that. Sometimes there will be, and I know that we have Violet here as the doctor, so please, I look to you to kind of help us with this. But there are numbers. We have heard that the Pfizer vaccine is something like 94% effective. And that's a very high number, but we have to remember that it's not 100% in preventing infection, but what we really look for is the serious illness and death, and from the follow-up reading that I did, Ruth, in terms of the Chinese vaccine in Seychelles, that there were some infections, very low symptomatic, and that the number of deaths was still very low, which it would not have been, previous to vaccination. So I guess those are two things, one, just being careful about what we hear about vaccines, and the rumor mills can go very quickly. So I know it's very difficult to keep track of all that information. And number two, Nabil or others, if you have thoughts about that issue of the bad mouthing of the Chinese and the Russian and other non-Western vaccines.
I'm
Yes,
not
Violet.
not a doctor. Yes.
I'm so sorry. I was just about to send you a text about a medical issue I was having.
No, please. I'm just managing a project that is under the People's Vaccine.
Okay, sorry about that. Sorry.
Thank you, Maza. Maybe Nabil, if you have something to add on WHO.
Yeah, sure. Just to add there, thank you, colleagues. So I think if we just take a step back, I think the broader question is one about decolonizing global health and ensuring that there's a level playing field, so that if you're if Indonesia, and I'll use a non-Chinese Russian example, if you're Indonesia, for example, or if you're Brazil and you've prepared and you've developed a vaccine, then the rules that are applied at a global multilateral level should be consistent, whether you're coming from those countries or the US or from Europe. And there has been some really good discussion from some people. I can even share around a link that was done by one very prominent access to medicines activist and expert. His name is Achal Prabhala, and he wrote for the New York Times about the importance of looking more at the Chinese and Russian vaccines. But I think the lens there is to apply a decolonizing of global public health lens to ensure equity and fairness and a consistent application of rules, depending on where the vaccines are coming from. Just on that same note, on this decolonizing of global public health, which I think is the big question here. Alan and others, you've touched upon this. I think I'm an adopted brother of Africa. I'm here in Nairobi, and I'm glad to be here and with you as well. But the current global response that we see, as many others have said, it stinks of colonialism. It's almost like we remember learning about the Berlin Conference of 1884, where European nations carved up the continent. You take a step back and you think, what's going on here in the way that the vaccine response is being decided? And the reason I raise this, colleagues, is that this is why the domestic production of vaccines is so important. Because if you're waiting for doses, if you're waiting for the next round of charitable allocation of vaccines from the UK, from Europe, from the US, and so on, you're not in control of your own fate. So that is important, and I think no country will want to say no to doses being charitably donated. But this is why the demand for a people's vaccine is so important. There's no substitute for countries to be able to produce their own vaccines. You know, this is why it's not a demand for charity; it's a demand for justice, and it's in response to this pandemic, because we know that's how we can produce the hundreds of millions and then into the billions more doses that are required. But it's then through the increase of that capacity that we can also prepare for the next pandemic. So I think understanding the decolonizing lens is very, very important to this issue, I think, for all of us. And that includes the domestic production angle that I've mentioned. It also includes, as Alan touched upon, you know, it's challenging these arguments that are being put out by people from industry that are underpinned in racism, that brown and black people can't be trusted to make safe and effective vaccines. And the reality is that if you look at the developing countries' vaccine manufacturers, you know, over 3.5 billion vaccines are already produced by the Global South each year. You know, you can find vaccines across the developing world which are doing this. So I think it's important for us to be resolute in these arguments and to not let people get away with these kinds of racist underpinned arguments, both in the governance and both in terms of the arguments to pursue domestic production now. I've probably gone on for too long there, Job. We have an Equals podcast, which we discussed it at length. On any podcast app, if you type in Equals, is discussed there.
Thank you, Nabil. Thanks, Nabil. If you're following today the African Union on Twitter, there's one interesting thing they posted about a scientist in Ghana who actually found the cure for the waterborne guinea worm with a drug called abachi, you know, and that was in the 1940s. So this notion that black and brown or people of color cannot produce safe and effective vaccines, I think has to be challenged publicly, and our leaders have to come out and challenge this notion that domestically we cannot produce vaccines. We have more hands up. I'll give an opportunity to Catherine. And then we also have questions coming from Twitter.
Hi, so I'm Catherine.
Go ahead.
Okay, so I'm Catherine Chokchunji. I'm the Executive Director of the African Population and Health Research Center, and been quite involved in vaccine advocacy, but more as a sole lone ranger more than in any kind of organized group. So happy to be here and to connect with you know, the people's vaccine players, especially on the African continent. So I had two comments / questions, and one is the assumptions we're making about Big Pharma, because Big Pharma has always been this entity that plays in this by certain rules and has certain values. And so the assumption that they want actually the pandemic to end. And I think somebody mentioned how it's possible that once the rich countries are vaccinated, they'll forget about the rest of the world. And I think Big Pharma knows that, and Big Pharma might be happy to sit tight and vaccinate people in the US, finish, and then wait for new variants to come, and then they produce boosters, and they can do this forever because there'll always be a supply of variants from different parts of the world, and then they'll just produce boosters for the rich countries. So that's an assumption that we all want the pandemic to end. It may not be in the interest of Big Pharma for the pandemic to end. And so that's one thing. And then the second thing, I think, I don't know, this Joab who just alluded to it right now, about the nationalism being a symptom of the world, maybe a broken global system. That Joe Biden may say, I support, you know, triple waivers, but then there are lobbyists that are an army of lobbyists that are fighting everywhere to make sure that America doesn't, you know, sign up to this. So that's the context. So based on that context, is the focus on maybe an IP waiver plus technological transfer, maybe putting all our eggs in a single basket, and perhaps whether it's time to examine other alternatives that are going to increase supply for us and for the rest of the world. And my understanding is that the pharmaceutical companies, their preference is the kind of arrangements AstraZeneca has made with the Serum Institute in India. So you get one partner, you strike a deal, your IP is safe with them, you're not worried about 1 year from now what's going to happen to your IP. But then the partner is carefully selected, and all this is, you're sure that this can happen the way you want. So they retain some kind of control. So is there a room for this kind of mechanism, perhaps parallel to the push for IP waivers? Find those who are those partners, and then maybe focus on, say, yeah, these are the ones, okay, maybe we should start matchmaking or something like that. That's one part. The second part goes to the last point that I think Nabil mentioned about decolonizing global health. And the fact that there's actually a Cameroonian gentleman in Nigeria who says he has two vaccine candidates, and he's been looking for money to do vaccine trials for the last few months, and they're not takers. So should perhaps the focus also shift to get this guy $10 million? Because I think it's Nabil who said that some of the estimates had immunity by 2024. Maybe by 2024, this guy's vaccine may have come out, and maybe it may turn out to be as good as AstraZeneca. So I think the bigger issue for me is whether the emphasis on IP waivers and technological transfer, perhaps we need to broaden the different strategies and that can result into more vaccines being available for everyone. Over.
Sorry, thank you so much, Catherine, for that intervention, and I think also questions. And Alan, I'll ask you to respond to Catherine briefly, but also speak to the question that has been asked through Twitter. How is the TRIPS waiver request similar to the AIDS one? And that the person who has asked the question specifically said directed to Alan. So.
Well, let me start with the last question around how the TRIPS waiver request is similar to the AIDS one. Basically, the request here is around providing information and knowledge around how to be able to manufacture for the case of HIV, it was ARV drugs. And in the case of ARV drugs, what then happened is that when the Indian company that was called Cipla was able to figure out what are the raw materials needed and able to demonstrate that they can be able to produce cheaper ARVs than what was being provided by the pharmaceutical companies in the north, what many countries did is that they allowed for something they call parallel importation. So they allowed for the bringing in of the vaccines directly without asking for permission from the license owner, which then put a lot of pressure on the pharmaceutical companies to either reduce their prices on the ARVs or to make them more available in the local scenario. Now that doesn't exactly happen for the vaccines because they are not like tablets that you produce and be able to send. So for the case of the vaccine, the challenge is this, and why a TRIPS waiver is extremely important. When you leave negotiation between pharmaceutical companies and individual countries, the countries have a lower hand in negotiating with the pharmaceutical company. And even though the effort to get the Indian company to develop more vaccines has then resulted into the challenge we're having with COVAX now, because we put all our eggs in the basket saying that because AstraZeneca has agreed to negotiate with India, let's hope they will move the COVAX vaccines to get through. But India, unfortunately, has been hit. And now for us to start again another conversation with another country that has got the ability to produce this will again take time in terms of the negotiation that can happen. And so the easier route out is trying to see how much pressure can be put to the WTO members to be able to agree to a TRIPS waiver so that it's open for all. And now anyone can go in and negotiate with anyone without any barriers being in place. And so I think that's why many activists are saying, let the effort be let the efforts be towards suspend TRIPS barrier so that at least everyone has an equal playing ground, because what we've seen with the individual negotiations, even in the case of South Africa with Johnson & Johnson, they are not transparent. Civil society are not around the table. You don't know what has been negotiated. It turns out sometimes you're paying more prices than what the North would be able to pay. But with the TRIPS waiver in present, that's possible. It's not easy to get a TRIPS waiver, but with solidarity and learning from the experience of HIV, sufficient pressure on leaders, sufficient pressure and naming and shaming of pharma companies in terms of how much profits they still want to make is still a way that we can learn from the HIV response. Otherwise, we would never be able to afford the ARV. So indeed, where there are countries that have the capacity to be able to have fair negotiations with pharmaceutical companies and to be able to produce, that can be explored. But the bigger problem is around just do away with the patents, transfer the technology, transfer the knowledge from a public health, from a public good perspective. And that's a war that could continue to happen. And so I think the WTO negotiations that are going to be happening quite soon are really, really important. And even the conversations happening now, the World Health Assembly, are really, really important in terms of putting that pressure, forward. So I think that similarity is important to say. COVID is a public health issue. We learned from the HIV response, where we even had situations of people in South Africa foregoing their medicines for the sake of ensuring that everyone else is able to get the same quality of medicine that they were getting, were part of the collaboration we saw between global North activists, global South activists, to be able to put the necessary pressure. Seeing, although we cannot do this with vaccines, but also I remember in the HIV movement, we literally had people flying in from Thailand to South Africa with the actual ARVs to be able to demonstrate that you could actually make drugs available. Or we had Ugandan doctors who are writing to CIPLA saying, I have patients, they need the drugs, could you please send the drugs to me? And as though there was a lot of hula baloo by the pharmaceutical companies in terms of you can't do that, the drugs actually came and people actually got treated. So we need some drastic, radical action. I know we are stuck with global movement, but that drastic, radical action is actually needed to be able to see how much more pressure can be put on pharmaceutical companies and many of the governments who host them and actually contribute through taxpayers' money to their research to be able to put the necessary pressure for them. I just want to also end and know that there have also been challenges with some of the countries that are holding vaccines. Some of the arrangements they've entered into the pharmaceutical companies does not easily allow them to transfer these vaccines to the global south. And so that sort of shows you the level of, for lack of a legal word, evilness in the pharmaceutical companies in the way they negotiate that even though you have got stock for vaccine, you can't even send it to country X or Y if there's a need for it. And that's part of the challenge that's seeing a country that already had a lot of vaccines beyond what they needed for their population, not being able to quickly shift them around to be able to ensure that those who need to do it need to do it. Then my last point and my emphasis remains, even though the African countries are laid to the table, if there's solidarity among the African countries that they're trying to do within the AU and the African CDC, they may be having a larger negotiation power, either for TRIPS waivers or either with individual pharmaceutical companies around larger production of vaccines locally to be able to get to more people. So I would still urge us to see what else can we do and how can we have global solidarity among us as civil society, putting the relevant pressure and working on the momentum that the Biden administration has put into place. And I think also Spain is supporting, and UK has shown positive signs towards trying to go to ensure that everyone has access to vaccines and trying to go into that particular direction. So I think we need to relieve our HIV activism in terms of trying to ensure that vaccines are available to everyone, but the long term is not just stopping at the COVID vaccine. As an African, for me, I'd want to see how the AU and the African CDC are working towards ensuring continued production of vaccines within the African continent and less reliance from pharmaceutical companies, because I believe we have the capacity. And as Catherine said, there is a gentleman in Cameroon who wants to do vaccine trials why wouldn't we show African solidarity as African countries and to be able to support that? My very final comment is around the fact that I know there's different efficacy among different vaccines. And for me, the position I take, though I'm not a scientist, is that once it's approved by WHO, it should be available for use by everyone. So the efficacy may be different, but if WHO says it's safe, right now I don't think we have the language to say I prefer the Pfizer to the Russian one. We're in a state where whatever vaccine you can get, just get it and to be able to move it forward. And I think my Kenyan colleagues can attest to this, where a number of people have managed to get the first shot of, not a number, a very few number of people have managed to get the first shot of the AstraZeneca vaccine, but now it's not clear whether they're going to be able to get the second doses. And there's a lot of shifts and pulling around in terms of, can we move vaccines from here to there in terms of where they're not being consumed quickly to areas where they're being. So I think we need to see how many more vaccines can be available in the market that are approved by WHO that can get to people as quickly as possible. Over.
Thank you so much, Alan. I think you touch on very pertinent issues. One of the things that Big Pharma have been hiding behind is that they invest a lot in research and development. And I think you've touched on the issue around the research and development being actually publicly funded. You know, people have been saying, you know, Big Pharmas have invested in research and development. How can they just transfer the technology or share the technology, yet they're not getting anything from it? So I think you speak to very key issues when it comes to publicly funded research and development. Before I come back to the panelists, I want to ask Eric to share his thoughts. His hand is up, and then I'll come to panelists and maybe just take the remaining time to discuss where do we move to, where should our energy be focused to, and what can we actually do as a collective?
Hello.
Yes,
Hello.
Eric.
Yeah, you're getting me?
Yes, Eric.
Yeah, actually, my big concern is I think Alan has talked about some of the things that you have said, but there's this issue that we are talking about when we are talking about vaccines and about Africa and other places. I feel that a vaccine should be available anywhere. We should not look at there is no pandemic in Africa. Let's not have a mindset whereby even right now our people in deep rural Africa, they normally when you leave a city and you go there, they just think that you're the one who has brought COVID or not, simply because one of the major reasons is that they don't have information. Nobody has invested on information on the issue of pandemics, the issue of the vaccine, issues of around research literacy, because even issues of side effects are nothing. Because I remember somebody who made a decision for us to take our ARVs, and I think that was a lady, I think Deborah Biggs, when she actually said, even with side effects, even if we take that medicine and then we get well and we are able to live for another day, and that was a decision that saved the world. So some of the issues around. It's important for us to have information on the vaccines. Vaccines are available. And I think a people's vaccine is a vaccine. I think Alan put it clearly that a people's vaccine is a vaccine which people would be able to get, notwithstanding the issue of side effects, the issues of misinformation. What we need a lot of information about vaccines on the ground, anywhere, be it rural, be it in an urban setting, and all that. And I think the other aspects, also you'll realize that for us to have a push, whether it's trips or dealing with the big pharma, when people have a lot of information, we'll be able to really push the people at the negotiating table such that people are able to access that. Because some of these things, when you look at the vaccine nationalism, when you look at issues around corruption at the expense of people's lives, notwithstanding where that corruption is, whether it's in the first world or second or first world or the second world or developed world. So I think those are things that we must ensure that are there. The information should be there. Then when we push, we know what we are doing, because we have vaccine literacy is important for the communities, yeah, because there's no investment in that, but people are ranting all over and actually confusing people, ordinary people who really need that support. Then it becomes a place where only people who have that access to information are the players in that. And I think this is a notion we just have to take off our minds for people to access vaccines. Not just vaccines, but whenever there's a pandemic, access to information is critical in making decisions, in engaging all sorts of people who are involved, or people making decisions on certain things, like, for instance, the issues around public health aspects. Otherwise, thank you so much.
Thank you so much, Eric. I also personally believe that our governments have not invested enough in terms of sharing information around vaccines. If they invested enough in terms of public building, public confidence, public awareness on the available vaccines, I think we won't be experiencing what we're experiencing now. The whole issue around vaccine hesitancy, which, to be honest, I don't think is true, will not be happening. We need the same energy we saw when COVID-19 started hitting our countries, the same energy that governments invested in asking people to wash hands, to keep distance. We need to see the same flowing when it comes to vaccines. So in terms of discussing where we move forward, and I know Nabil, thank you so much for sparing 30 extra minutes for us. And I'll just come to you, if you can speak to us on where does the focus lie now? Who should we be targeting, and where are the barriers?
Thank you, Joe. Thank you, colleagues. And I apologize, I have childcare to get to. Otherwise, this has been a very enriching discussion, and thank you for letting me be part of it. So look, I mentioned three key areas at the start, and Alan has spoken very eloquently about the importance of the waiver. So right now, the blockers of the waiver, just to put it to be clear, are Germany, the European Union, and there are others as well. I think concerted pressure on those nations to follow South Africa, to follow the 100 countries that have supported the waiver. I think that's going to be very important now. I think they do need to feel the pressure as well. The Biden decision is remarkable. It's given us momentum and so on, but I don't think there's anything for us really to celebrate yet. We can celebrate when we get a people's vaccine. There is momentum for sure, and that momentum I think has to be directed there. I think that's one key thing. I think the second thing that's been mentioned here is that I think it's very important to be calling out big pharmaceutical corporations' bad behavior quite clearly. This isn't about ideology. This isn't about anything like that. This is about their monopolies, and we have to be clear that these are monopolies that are standing in the way of billions of people getting the vaccine, and we have to call that out. A few days ago, the People's Vaccine Alliance released data. I mentioned it earlier. The vaccine has created 9 new vaccine billionaires. It's also enriched pre-existing pharma billionaires, and these are publicly funded vaccines. That is extremely problematic from the same folks who are claiming that it's very difficult to be vaccinating the world. So we've heard references to the HIV/AIDS movement and the power of that movement in the early 2000s, and of course in the late 90s. And one of the things I've learned from you is the importance of exposing that behavior. And I think we need to keep at that. So that's the second thing. I think that's the main points. I think the third one I would add is something we've discussed here, is that whilst it does feel that the blockers, that some of the power on this issue is on in the north. I think the more that developing countries raise their voices on this issue, I think President Ramaphosa of South Africa has been excellent on this issue, for example, and I guess he shows how it should be done. If every developing country leader around the world that's going without vaccines in the way that we are today was raising their voice, this issue won't fall off the international agenda. They will feel the pressure. It needs to be called out, for the criminality that it is, and leaders respond to pressure. And I think, in every country applying that pressure, as well as showing the solutions that we've discussed, that the manufacturing capacity, it does exist. Keeping on making those arguments. I think that's a key. I think the pressure has to be felt on the north. They can't wind the clock down here. They can't hope for the issue to fall off the international agenda, because the opponents of a universal vaccine, I think that's what they want to happen. And I'll close by, I think it was Catherine who spoke to this point very eloquently before. Let's be clear. The interests of the big pharmaceutical corporations is very different to the interests of global public health and the economic recovery. These two interests are at odds. There's not a middle way. We're on one side right now. It's going to be one or the other. And I think we have to be clear about that. We can either live with this deadly pandemic for years, which is what the data is showing, or we can have another way, and we can't wait another day. This is extremely urgent. We've all lost loved ones. We don't want to lose many more, and that's what will happen, I think. Let's be clear, unless we take the urgent action necessary. So, Job, yeah. So, number one, action on the waiver, particularly Europe, Germany. Secondly, really being clear about big pharmaceutical corporation behavior. And thirdly, ensuring that the pressure is there from people and from countries from the south.
Thank you so much, Nabil. I think you point out very key issues that we can continue putting pressure. And when the continent comes together and raise its voice, as all members of the African Union have supported the TRIPS waiver, have rallied behind South Africa and India's proposal to waive IP, I think we can actually achieve it. We've seen Ramaphosa actually has been very vocal on this. Kagame has been very vocal, and we need more leaders. We need the voices, African voices, such as those that were speaking yesterday at the World Health Assembly calling for technology transfer. We need to see that at the top leadership of our government. Thank you so much, Nabil. Alan, we're just talking about how do we move forward? What can we do together? I know you spoke to this before, but how do we move forward as a continent?
I think as a continent to move forward, I think for me, 4 things stand out. The first one is, how do we have the solidarity that allows for African countries to come together and negotiate for ability to have local manufacturing of vaccines, and for that to be able to happen? Indeed, that TRIPS waiver is critical, and so they have to be able to support that. But local manufacture of vaccines is something we need to start taking forward as the African continent, and that this squarely falls in the hands of the AU, in the hands of the African CDC, to see what kind of conversations can then be able to happen. And as much as we are talking about the need to ensure everyone is vaccinated, I think the second important thing is to say we need to be sure that our health systems have been strengthened from a rights-based approach that says we have enough healthcare workers, we have enough community healthcare workers, as Eric was talking about, the importance of vaccine literacy. I think one thing that made the HIV movement really succeed in terms of adherence was the treatment literacy. When you interact with communities of people living with HIV, they know their drugs, their side effects on their fingertips, and they clearly are able to engage. We need such level of investment in our health systems where people exactly know what is the vaccine, what are the side effects, and how can they be able to handle this. And I think the importance is that we could be pushing for a TRIPS waiver and more local production, but we may be let down by our systems. And so it is important for African governments to take a Damascus moment now on COVID and say they're going to try to ensure we have enough healthcare workers, we have enough people who are able to serve the healthcare system. We are paying our healthcare workers well so that they are not either striking or seeking jobs elsewhere. So it is very important to ensure that we ensure that our health systems are actually working to be able to take these vaccines forward. And I think then going forward and in the longer term, and what we must definitely think as every country in Africa, what steps are we taking towards sustainability to fund our own health programs, to reduce leakages and corruptions in the health system, because there's plenty of money that goes to waste, there's plenty of resources that go to waste. So in the long term, how are we trying to ensure we are actually outliving the Abuja Declaration and actually investing more than 15% towards healthcare? Because I believe the time has come to surpass the 15% of Abuja and actually be self-reliant in terms of supporting our people for healthcare. So for me, those would be my take-home points, but definitely a TRIPS waiver is inevitable if we really want to win the war against the COVID-19 pandemic. Over to you, John.
Thank you so much. I think the 15% is very critical. Even just meeting the 15% for most of our governments, it's very critical. And I think you highlight a very key issue of strengthening of our health systems. This won't be the last pandemic to hit Africa. And this pandemic, one of the things that it has exposed actually is the power of public healthcare. Very few people, for example, in Kenya can afford 600,000 Kenya shillings just to pay before they're admitted to the private hospital. So strengthening public health system is very critical. You speak to the issue of solidarity among African countries, and if they speak in one voice, I'm sure they will be able to negotiate. They've shown some solidarity throughout the pandemic by coming together, procuring protective gears as a continent, and that action needs to move from that and to start showing it as a global force in global negotiations. We are also seeing solidarity in terms of countries sharing the vaccines that they may not be able to administer before they expire. I saw, was it last week or this week, that DRC actually shared its vaccines with Kenya, on realizing that they might expire before they actually administer them. So we need to see the African solidarity. Back to you, Maza. We've not seen African citizens actually aggressively demanding for a people's vaccine. How do we get the African citizen to be engaged in this discourse?
I think that we are engaged. I wonder if we just have not put enough pressure on our governments, and maybe the way we put pressure is different from those in the global north. I think what has been very nice to see is the activity, even in terms of knowledge. This is something that Joab, you and I were in a discussion a couple of weeks ago, the People's Vaccine Alliance, just to have people asking questions. We're no longer at a point where you can do things in Geneva and expect that African citizens will not be aware of it. People are asking questions, are aware of, our colleague who was asked the question earlier, I think it was Rachel, people are aware of the different information that is being shared about vaccines and their efficacy. I think Nabil's points that he brought up are critical, those pressuring the countries that are blocking the waiver, making sure that manufacturing and know-how is really pushed. And also, I think it touches on what Alan is saying, increasing the capacity of our country's health systems and really pushing for that in our own countries, but also addressing this question of confidence. And Alan brought up something earlier about, people shouldn't be deciding between the Pfizer and I want this vaccine, I want the other vaccine. If one is available to you and if it has been deemed safe by the World Health Organization, even if it's not your first choice, the more people who are vaccinated, the more likely we will be to reach herd immunity, and I think the work that's being done on the TRIPS waiver, adding to manufacturing, making those other vaccines available, whether they're the Chinese, the Russian, eventually, hopefully the Cuban, will be more likely to be protected as a herd, as a group. So I think, Joab, hopefully the work that all of us are doing at the People's Vaccine Alliance to get the Global South voices to the table will make it clear in terms of how we can better coordinate all the agitation that is happening in our various countries. I think people want these COVID-19 vaccines, and we need to make sure that we are better coordinating the work that is being done and telling people where advocacy opportunities are. I know that in the global north, people went to Pfizer's office and protested there. There are not that many Pfizer offices in Africa. So where, if there is a place to do kind of a physical action, where would that take place, or would that be better done through AVDA? As I mentioned, there is a community engagement arm at AVDA, and they're very keen to have participation from civil society organizations in Africa. So I have put the link in the chat, and Joab, I hope, or the People's Vaccine Alliance Kenya, hopefully will share that information, but they are keen to have input, from either people like yourself, Alan, or others, civil society organizations, just to make sure that those voices are being heard. There was one question in terms of vaccine hesitancy, which I saw on the chat, and I would just again reiterate the same message, that the information we're getting is that there are many rumors going around on WhatsApp and on social media about vaccines, but the data shows that Africans are ready and waiting for COVID-19 vaccines. And that's not to say that we don't have to make an effort to make sure that truthful information about side effects is shared. That does need to happen. I think we also need to identify trusted stakeholders who can also share their experiences with getting a COVID-19 vaccine, or sort of give people who are trusted stakeholders, whether it is on social media, on community radio, at community meetings. There are many levels at which we can make sure that this message passes. And I think that as African civil society, we will do our best to make sure that happens. So I hope I've answered your question, Joab. I think there is a lot of agitation happening in our countries, and we need to make sure that that message gets out in a way that can be heard and plays a role in the kind of strategy shifts of the People's Vaccine Alliance at global level. And I really, unfortunately, Nabil had to jump off. I know you are part of the People's Vaccine Alliance as well, and I really commend everybody at the People's Vaccine Alliance for the work that has been done thus far and for trying to make sure that African voices are at the table.
Thank you, Maza. I think the other thing would be in terms of filling that information gap, African Alliance has been developing the solidarity packages, so maybe we might want to discuss how to start distributing that to the people.
Yes, and just to be clear, the African CDC is developing the strategy package. Tian Johnson from the African Alliance sits on the AVDA, on the African Vaccine Delivery Alliance. And yes, the African Union is developing with Africa CDC these solidarity packages for the countries to track access and also to help with issues of vaccine confidence. And please, I would encourage everyone who is on this call, if you would like to join our monthly African Alliance calls. I know that there are a lot of Zoom meetings happening, and we're all probably very tired of those at this point, but we will, even if you can't join in person, we'll be sharing them on our Twitter feed. And please follow People's Vaccine Kenya on Twitter. They're very active. Please follow People's Vaccine Alliance. Please follow African Alliance, and we will share as many of the updates as we can there. Thank you.
Thank you so much, Maza. Coming to you, Violet, there was a question around accountability. Yeah, at the global level, we're pushing for a big pharma to share technology, to share the knowledge so that we can scale up the production. But we've seen the little doses that have been trickling down in our countries, being actually not fairly distributed, the most vulnerable being left out. As a representative of a frontline workers union, how do we ensure that actually governments target the most vulnerable? Violet.
Okay, Joab. So I think right now, what has been happening is different organizations has been calling out government at very different intervals. And I think what would be more fruitful or helpful is we could all come together and call out the governments together as one voice and tell the government that we are aware this is happening and that you're not following the protocols, or do you have a plan? And could we even help government circulate the plan that they have in place? Yes. So for me, it's actually the organizations or the institutions that are working towards a people's vaccine are talking to government in one voice. Because if we each come talking to government in different voices, then we lose the voice, we lose the message, and most of the time it's very easy for government to also dismiss you. Yeah. So that would be my take on that. But yes.
Yes, thank you. I welcome some suggestions from the other participants in this discussion on how we mobilize together and how we move forward.
I'm sorry, Joab, my internet just went out briefly. Can you repeat that last question?
I'm welcoming suggestions from other participants other than the panelists. I can see Peter Whitty's hand is up. Peter, do you want to come in?
Oh, thank you very much. Sorry, I had raised my hand a little bit longer before. I just had a comment to make on the previous issues, and one is the TRIPS waiver. And it is a feeling that the TRIPS waiver should go beyond the vaccines. It should cover all the three pillars, and that is including the therapeutics and the diagnostics, so that all these things and technology move concurrently. I did also hear about the bilateral agreement, something about bilateral agreement. And it is my feeling and discussion of a number of people that bilateral agreement is not good enough for Africa, because there are some countries that went and bought all the vaccines produced at a very high cost. And so if they're going to sell them at a higher cost to desperate countries, either as loans or as in terms of cash, then it's going to be very expensive, and that's going to exploit the little resources. So we feel, our feeling is that the vaccines should go to CETA, so that to COVAX or to Sabin, so that the vaccines are provided in a pool other than a bilateral agreement. And lastly, I would like to comment about the community health workforce. We remember the African Union, together with the United Nations, established a 1 million target for the workforce, and that was in tandem with the need to have a workforce that can be able to handle epidemics like the one we are facing. And somehow it's stalled on the way. And Eric has already alluded to that we need to handle epidemics, we need a community that is enlightened, a community that can use diagnostics and administer therapeutics. And that is the basis of the current diagnostics. We want rapid antigen tests, which are community friendly, that the tests can be done at community level before they are referred to the hospital. And lastly is the issue of bringing in the local producers, not only for vaccines, but also for other products. We have seen Singapore has come up with a breathalyzer, which can be able to detect COVID in the breath within 30 seconds. And we know we have technology both in the diaspora. We have a lot of African scientists in the diaspora who need to be encouraged to come back into the country and help us manufacture some of these things. And that is the only way we can do. And lastly is the issue of governance. We realized that most of the time we were fighting the government as civil societies. We were worried that the government is confining people unnecessarily. The government is making people pay. And these are lessons that we have learned across the board. That honestly, in an epidemic like this, we need a strong partnership between the civil society, the government, and communities so that we can work together towards eliminating the pandemic. And this, the direction that I think that strong bond should be the health system connector should be funded by both donors and the countries to strengthen the partnership between the government and communities. Thank you very much.
Thank you so much, Peter. We understand that this won't be the last pandemic to face the continent, and therefore we must take a holistic approach. It's not just about the COVID-19 vaccines, but also to vaccines related to other diseases that are likely to affect the continent. And maybe to transition into the next session. And so on the agenda, there's Tian, who is not here, unfortunately, but Maza, I'm sure you can speak briefly about the African Charter, which I'm sure addresses some of the key things that Peter speaks to around looking at this as a holistic approach to public health in Africa, or strengthening public health systems on the continent. So if you can just, I know it's still under development, but you can say something about it.
Thank you, Joab. I just first of all would like to second what our friend Peter has said here and what others have said so eloquently. You've also mentioned several times, Joab, that this will not be our last pandemic. It is quite frustrating to see so many of the same issues that were brought up with the HIV epidemic coming up again, especially for those of us who are old enough, as my gray hair shows, to remember that time and the struggle for ARVs, having lost, 3 cousins from one aunt to HIV before ARVs were made available in Ethiopia, as people were arguing about whether Africans could take medication on time. So, that leads into the African Charter on COVID-19, which we are currently in the process of developing with the blessing of the African Union. This will be an African Charter signed off by civil society organizations. It's currently in a very draft form, and Joab was with us in a discussion about this, but really on COVID-19 more broadly, that does address issues of decolonization, of also health systems, strengthening of community engagement, and of access monitoring. So I would encourage people, if you can join us on Thursday, I have just put the registration details in the chat. We will provide more of an update then. We are also on our website putting a link if you would like to be involved in that drafting group. We would be happy to welcome you to participate in that drafting group of the African Charter. We'll also be developing terms of reference for the steering committee for People's Vaccine Alliance Africa. So there will be a steering committee who will be counted on to do more of the regular week-to-week work. The rest of you are welcome to just join once a month and chat and hear what's going on. But we would like to have a regularly meeting steering committee that can do the drafting of documents and really steering. I think that's why we call it a steering committee, like driving the bus or the car with us to make sure that African voices are included in the work of the People's Vaccine Alliance. So sorry, Joab, the charter is still in draft form, but it will be a charter on COVID-19, not just on vaccines, trying to address the broader issues of decolonization, access, manufacturing, etc.
Thank you so much, Maza. I think we're coming to the end of this discussion, and I would like to welcome just some last remarks from the panelists before we conclude. Alan?
I've already spoken enough, but I just want to say thank you, Joab. Thank you very much for having me. We really appreciate it.
Thank you. Alan?
Likewise, I'd say this is a great opportunity to have had a conversation with colleagues across the globe, and we need to keep up our efforts in the fight against COVID, and one of those efforts involves pushing for a TRIPS waiver. So I'll just encourage everyone who's on this call to continue joining the people's vaccine movement and any other movements that are working towards getting a vaccine for people, and not a profit vaccine, but also ensuring that we win the war against COVID. Thanks for having me, and it's been really a rich and interesting conversation.
Thank you, Alan. Violet?
Joab, thank you very much for inviting me for this session, and for just getting to listen to Alan, Maza, again, Joab, for moderating a very lovely session and asking very pertinent questions that have made us think and even just come up with clear action points on what we need to do going forward. I'm very grateful for that. I've taken note of the action points, and maybe it's time to begin thinking, what can we do as KMPDU with regards to some of these action points? So I'm really, really grateful for that. Thank you.
Thank you so much, Violet. Just to end the conversation, I think it's upon us here to try and make sure that COVID-19 does not become an African disease from next year onwards. We must pull together to ensure that everyone in Africa has access to a free, safe, and effective vaccine. And I think we've highlighted key issues. Just to mention a few, we must continue raising our voices against the blockers. We must continue calling out the big pharma behavior. The big pharma bad behavior, as Nabil called it, the big pharma monopoly, I think it's going to hurt us all. We must continue mobilizing our government so that they can speak in one voice. We must continue calling on them to be transparent on the contracts that they're signing with pharmaceutical companies. We must call on them to share the plans that they're sharing with COVAX so that we can hold them accountable and ensure that the most vulnerable are actually targeted. The solidarity that Alan spoke to, I think we must continue as citizens, as the people of this continent, to continue speaking in solidarity, but also asking our governments to actually speak in solidarity. It's the first time we're having negotiations on a TRIPS waiver where and the WTO is being led by an African woman, the very first African to lead the WTO. And I think we know that the US has supported the TRIPS waiver, but we normally say the devil is in the details. So the language of the TRIPS waiver will matter a lot, and therefore we must continue paying keen attention to that. We must know that this will not be the last pandemic to hit the continent, and therefore strengthening health systems will be key to the continent being resilient to future pandemics. With that, I want to thank you all. I know I'd not introduced myself. I left it for the last so that I'm the only person you remember after this discussion. My name is Joab Okanda. I'm with the Oxfam Pan-Africa program. I'm happy to have moderated this session, and I thank you all for joining and for contributing immensely to this discussion. Let's continue with the conversation offline and online. Thank you.
Thank you.
And thank you so much to the organizers, the People's Vaccine Alliance Kenya, Suhail, Hilda, and the team. Thank you so much.